Atit Neurology video series, let's discuss myasthenia gravis. Myasthenia gravis is an autoimmune condition, meaning it's your own cells which are attacking your nervous system. In this case, the pathology lies usually in the neuromuscular junction, where there's a decrease in acetylcholine, and that is what causes the weakness of the muscles. The muscles affected in myasthenia are the eye muscles, the muscles of swallowing, breathing, and all the limb muscles. So the most common symptoms are the drooping of the eyelid, which we call as ptosis, double vision, difficulty swallowing, which is usually more to liquids than solids. Also, when you drink water, sometimes it can come out of your nose, what we call as nasal regurgitation. You can have difficulty breathing, and you can have generalized weakness, meaning weakness in your hands and legs. But sometimes the symptoms might only be related to the eyes, what we call as ocular myasthenia, just drooping of the eye and double vision. Sometimes the eye can be deviated to one side, what we call as ophthalmoplegia, just difficulty swallowing. So how do we diagnose myasthenia? Usually it's a clinical diagnosis, and then we also send testing for checking the acetylcholine receptor antibodies in the blood. There are different types of acetylcholine receptor antibodies, out of which we usually check the binding. The binding is the one which is most affected and the most relevant. Sometimes we have different other antibodies, like anti-MuSK antibody, which is muscle-specific kinase. So we can check it by laboratory tests. We can also check it by EMG, which is a more specialized way, really, of checking myasthenia. Sometimes you can just give a trial of a medicine and see if the patient responds to that medicine. Well, how do we treat myasthenia? Because it's an autoimmune condition, a lot of the medicines are geared towards autoimmune condition. A lot of the medicines we use are similar for autoimmune conditions. One of the most common medicines in the older medicines is mestinon, generic name pyridostigmine, and that we give basically 3 or 4 times a day, usually 4 times a day, and see if the person's symptoms are improving. And usually that only helps when you give the medicine. That doesn't have any long-lasting effects. Side effects can include too much release of acetylcholine. So you might have increased saliva, you can have diarrhea, abdominal cramps and pain. Steroids have been used for a long time too as part of autoimmune. I'm not a bigger fan of steroids because too many long-term side effects I feel, including increased blood sugar, low potassium, can increase the blood pressure, can cause agitation, can increase risk of peptic ulcer disease. IVIG, or intravenous immunoglobulin, can be used. We usually give it every 3 weeks to every month. And then we have a lot of newer medicines on the horizon, which are very effective, very safe, but often we are hampered by or limited by insurance asking us to try other medicines before we try these newer, more expensive medicines like Soliris, Ultomiris, Vyvgart, Rystiggo, which is also approved now for anti-MuSK myasthenia. So we have a lot of exciting new medications on the horizon for myasthenia. We also have some of the older medicines which we've been using for a long time, like Cellcept, azathioprine. I use Cellcept sometimes, but most of the times my regimen is mestinon, IVIG, and then one of the newer medications.